now call upon our next speaker, Dr. Beni from India, to speak on the subspecialization in urology in the perspective of a urology trainee. Over to you, sir.
Ayubovan, Sri Lanka. Good evening to all, respected chairpersons and respected dignitaries in the chair. Okay, today I will be speaking on subspecialization in urology, my perspective as a urology trainee. So where do I start with? Introduction. Urology is basically a vastly evolving surgery. In being a subspecialty in itself of general surgery, to subspecialization of its own. Oh, how far we have come. The subspecialty can be broadly divided into endourology, uro-oncology, pediatric urology, female urology, neurourology, reconstructive urology, minimally invasive urology. Now it is laparoscopic separate, robotic separate, andrology, renal transplantation, and it is not limited to this. So, what are the Indian perspective of a urology? So, there are give or take around 3,600 to 4,200 urologists for a population of 1.3 billion. One urologist per 5 lakh population. So, there is definitely a void and a lacunae of urologists available for the service. Most of them are concentrated in the cities because the armamentarium is available in the tertiary care centers. And our disease burden, 70% of our diseases are stone diseases or lower urinary tract pathology. So this discussion is on. So what are the benefits of subspecialization? So you get an exposure to the entire spectrum of a disease if you are a subspecialist. You will get to see all the clinical presentation. You will get to see all the surgical practices of that subspecialty. You will get to see all the complication and you'll be well versed in tackling those complications. Understanding the natural history of those diseases, better scope of researchers. There will be a lot of data available. You can do a retrospective cohort, you can do a prospective cohort, you can do an RCT. So it is a heaven for a research-oriented person. Better scope of newer innovations. When you are at it day in and day out in a same specialty, you will definitely conceive newer idea. You can nurture it, you can develop it and deliver a newer innovations. So which will lead to what? Definitely that will lead to a better patient outcome, improve the cost effectiveness, better resident training, and build a strong referral system. I should emphasize, if we are going into the practice of subspecialty, building a strong referral system is the backbone of subspecialization. So, me as a surgical trainee, to choose a subspecialty, I am in a non-enviable position of choosing from so much subspecialties and evolving branch of urology. So, a study undertaken by Dr. Sabni sir sitting over here, and he has asked 85 urologists in practice training in the urology, asked which band would they like to subspecialize in. They've told that endourology, uro-oncology, as you can see, and laparoscopic robotic surgery takes the front seat, where andrology, female urology, and others takes the back seat. So we have to have a caution over here. So who would take up those branches? We have already losing our vascular access to vascular surgeons, to your general surgeons, and plastic surgeons. So if we can't we have to keep those branches also in mind. So Dr. Sharan in 1994 told that he needs andrology as a different branch altogether. So, as we urologists, if we snooze, we lose. We will be in a danger of losing all those specialties to other subspecialized people. So, what are all the challenges ahead of us if we are going to train ourselves in subspecialty? What are all the challenges? So, the first challenges is in the training system only. There is a lack of uniformity in quality and quantity of training. Why? Because there are different setups over here. Government versus private sector, tertiary versus community hospitals, and disease burden of those population we tend to. So we can't ignore those things. So different setups will be having one people will be having a better training in endourology, for example. One setup will be having training in robotics or laparoscopic, this thing in more common. So the training has to be uniform over here. So we have asked about the disease burden of, the same study asked for the disease burden in different hospitals. So as you can see, endourology and uro-oncology takes the front seat again. Whereas the training in andrology and robotic surgery is less than 10% over here. So we have to agree that there is a discrepancy in our training system, and that itself will pose a challenge in our further subspecialization. So what are all the other challenges we are facing towards our subspecialization? Loss of relationship with the other subspecialty area. If we have a lack of proper referral system, then we have, I've already told that the proper referral system is the backbone of subspecialties, and also all the armamentarium are available in the Tier 3 cities, so there is definitely a difficulty in practicing Tier 3 cities for some. So, general perspective of urologists, our urologists are already ready. When they ask for whether they would go ahead and choose a subspecialty, everybody has told yes, and everybody has told that they have already their system of training has they have put them in a position where they can take up a subspecialty of their own choice. So what is my perspective in this? I, as a urological trainee, would ask you to take it with a piece of caution. So a general urologist with an experience and skill in all areas of specialty are an asset to a society. There is no question about that. We know that the subspecialization is the future. So how do you go about it? So while practicing your general surgery, general urology, you have to find your niche and skill and nurture it. To have a great mentor. You have Dr. Zishan Hamid sir over here, who is my HOD. You have Rajiv TB sir over here. You have other dignitaries over here whom will mentor you and support you in your effort. So finally, what I have to say is to love the subject, learn your trade, and practice. Even the great minds of our time agrees about the same. Thank you.